So in this video, let's talk about pupillary responses to light. So first of all, we have to know what the normal response is, right? So whenever there is any light being shown into your eye, your pupil will be constricted, okay? And when the light is removed, your pupil will get back to dilated, okay? And just remember that this occurs in both the eyes. So whenever light is being shined in one eye, the other eye's pupil will also be constricted. And when the light is removed, both the eyes will get back to normal, that is dilated. So you can see in this video, when the light is being shined in this patient here, the pupils are getting constricted, right? And when the light is being removed, the pupils are dilated. Here it is more clear. There was constriction when there was light, and now there is dilation. Right, so this is the normal pupillary response. So once more, here there is constriction, and here when the light is removed, there is dilation. So that is the normal pupillary response. So when do you see these conditions? Unilateral dilated, that is one-eyed, one-sided dilatation, bilateral dilation, and bilateral constriction. So when do we see these conditions? So unilateral dilated pupil is seen whenever there is any kind of space occupying lesion. So just imagine this being your brain. This is two sides of the cerebral hemispheres. So if there is any lesion here, okay, so any space occupying lesion, it could be a tumor, it could be a hematoma, that is nothing but blood clot, or it could be a brain infection or an abscess, right? So when this part is being affected, there is a chance that the optic nerves that are going through like this, any nerves that are participating in the optic pathway being compressed. Therefore, there will be unilateral, because this lesion is just on one side, right? So there will be unilateral dilated pupil, okay? So we can see how in this patient there is unilateral dilated pupil, right? The next one is bilaterally dilated pupils. So this is usually seen in drug overdoses, okay? So drugs like amitriptyline, which is a tricyclic antidepressant, or cocaine, which is a stimulant, all right? So these two drugs can cause bilateral dilatation. So you can see in this patient, when the light is being shined also, there is no constriction of the pupil. It still remains to be dilated, and it is on both the sides, both right and left, right? So this is nothing but bilateral dilatation. And bilaterally constricted pupils is a classic sign of opioid overdose. So you can remember it as opioid, I-O-I-D. So there are two O's, right? So just remember it like this, opioid, bilateral, both the sides, your pupils will be constricted, all right? So opioid overdose, bilateral constriction, and even if there is any cancer in the brainstem, okay? So brainstem is not a space occupying lesion, right? So your brainstem is coming like this, and if there is a tumor here, both the sides will be affected. These are your cerebelli, and these are your cerebrum, and these are your cerebelli. So both the sides will be affected because it is in the center, all right? So it won't be unilateral, it will be bilaterally constricted pupils. So here we can see how this patient has a unilateral dilated pupil. So this is the normal size of the pupil, and here we can see that it is clearly dilated, and here it is the other way around. This is normal and this is dilated. This is unilateral dilatation, which is seen due to any space occupying lesion in the brain, which could be a tumor, hematoma, or abscess, or any kind of space occupying lesion. This is unilateral dilated pupil. This is bilateral. This is bilateral dilated pupil. As you can see, both the sides, the patient's pupils are dilated. So this is seen in drug overdoses such as amitriptyline, which is a tricyclic antidepressant, or cocaine. All right. And here we can see bilaterally constricted pupils, right? So the classic thing you have to remember is opioid. Okay, opioid overdose will have bilaterally two sides constricted pupils. All right. So that's all about the pupil responses. Thank you.